Hey everyone, welcome to today's Training Health Sketch. In this video, we will be focused on providing care for people or the patient with specific illness. And you will see the demonstration on how to perform oral care for a patient. So these essential skills will definitely enhance your nursing quality for a patient care who is disabled or who finds difficult to perform the oral care by themselves.
Oral hygiene is a vital part of the patient care as it prevents infections, promotes comfort and supports overall health. Before beginning the procedure, it is important to ensure patient safety and privacy. Always remember to close the curtains and use appropriate screens to respect the patient's dignity. Once it's done, you also need to make sure you adjust the bed and the trays appropriately for the process. Once the privacy is maintained, approach the patient professionally and calmly and explain them the procedure in a simple way, informing the patient about each and every step that will reduce the anxiety and builds trust. After explaining the procedures, prepare yourself and arrange all the necessary required equipment in organized and a professional manner. This ensures the process in a smooth and safe for both you and the patient. Remember, the hand hygiene is a critical step. Wash your hands thoroughly or use hand sanitizers before the process. The patient care is always important in a professional manner. When providing oral care, it is important to maintain a correct posture in front of the patient. Stand in a comfortable and professional position without leaning on the bed or resting your hands on unnecessary surfaces. This not only maintains professionalism but also ensures proper infection control. Always remain attentive and focused throughout the procedure. Never leave the patient unattended while oral care is being performed, and this may place them at risk. When brushing the patient's teeth, begin with the upper teeth using a gentle but firm strokes to remove plaque and food particles. Move systematically across the areas to ensure thorough cleaning. Then continue with the lower teeth and again use professional technique to maintain oral hygiene and patient comfort. Students are now explained and demonstrated the correct steps to follow after brushing. Once the patient's teeth have been brushed, the toothbrush must be placed properly. Cover the brush with a clean tissue to prevent cross-infection and maintain hygiene standards. Once the procedure is completed, remove your gloves immediately and dispose them into the appropriate waste container. In the next step, students are explained that the patient should be given a small amount of water to rinse the mouth. The water should be then expelled into the suitable container such as a kidney dish. Once the patient has rinsed and expelled into the kidney dish, the dish should be carefully removed from the table and disposed properly. After this step, always check the patient's comfort and ensure they are feeling well. Being attentive to their needs shows professionalism and compassion towards your career. By following these steps professionally and properly when you are disposing them, it will also prevent from cross-infection and contamination for the patient. Next, in this demonstration, students are shown how to provide oral care for a complete disabled patient who is unable to rinse or brush independently. The procedure begins by securely wrapping a piece of a sterile gauze around the tip of a long artery forceps. The forceps with the gauze is gently dipped into the clean water using the proper technique. And then, the students are demonstrated the professional technique methods how to open the mouth and clean in a professional way. Gently open the patient mouth and carefully clean the gums, tongue and the inner surface. This method prevents the effective oral care while ensuring the patient's safety and comfort. And once it's done, immediately throw the gauze in the appropriate container and clean it. After completing the procedure, gloves must be removed and disposed correctly. Hand hygiene should be again performed properly with the sanitizer to maintain the risk of cross-infection and maintain a safe clinical environment. After completing all the steps and the procedures, it is important to document the care provided. A short and accurate record should be made immediately, noticing the steps performed and the patient's response. Documentation ensures continuity of care and maintains professional standards. Once the lecture and demonstrations are completed, it is now time for my students to participate. Each student will participate the correct process step by step. By practicing these steps professionally, they will build skills and confidence in providing safe and professional oral care. Following the demonstration, students are given the opportunity to engage in hands-on clinical practice. the clinical practice allows them to apply the techniques demonstrated in the real-life applications, ensuring that all steps are performed correctly and professionally. During this training, students are encouraged to follow the instruction properly, which not only reinforces their understanding but also builds their confidence in performing oral care for able or a disabled patient. By practicing these procedures in a structured and a supervised environment, students also develop both competency and professionalism. Through consistent practice and guided instructions, they become capable of performing oral care procedures effectively, safely, and with high standard of patient care. Oral care is a vital part of patient management for several reasons. It helps prevent infections and maintain oral hygiene, reducing the risk of dental and gum diseases, promotes overall health and ensures patient comfort effectively. Through this supervised training, students gain valuable hands-on experience, strengthening their skills and becoming competent in providing oral care in professional techniques. Finally, once all the demonstrations are completed, they also perform the correct techniques of documentation to ensure the recordings are done appropriately.
Alright guys, thank you for watching my video on today's session, and if you find this useful for you, please don't forget to subscribe my channel and press the bell icon. Stay connected and see you on another session.